Well, how do you recognize sleepiness in patients in the clinical sense?
Well, the process of recognizing and understanding sleepiness begins with simply taking a history. And the way this happens in the clinical setting is that the sleep medicine specialist asks questions of the patient. And I might add that sometimes we get excellent information from the spouse or the parent or other individuals who are in that person's life. Again, alluding to the fact that sometimes the patient himself or herself does not have full awareness of how sleepy they are. But we ask questions about the individual's sleep-wake schedule, bedtime, rise time, how are they sleeping during the night. We ask about when during the day is the individual excessively sleepy. Is there a certain pattern? And we ask about how severe is the sleepiness. In other words, is it just a minor inconvenience, or is it a sleepiness that is to a degree that it affects the person's ability to perform their work, to succeed academically, to regulate their emotions, to support normal thinking skills such as paying attention and learning and remembering.
It's also socially disabling and isolating.
Absolutely.
Can you talk about some things you've heard from people about what their life is like because they're sleepy all the time, things that are said to them?
These are the things that often bring people into the Sleep Center for evaluation. The impact on quality of life is immense. Individuals tend to drop out of their activities, church or after-school activities. They tend to have less and less social interaction. Their life is dominated by the need to lay down and take a nap. And this becomes very isolating. There is often a mood component.
How could there not be a mood component?
That's
Thank
right.
you for bringing that up.
A lot of depression and isolation, and sometimes the individual actually just feels hopeless about their sleepiness. They tend to have fewer enjoyable activities, and it just basically degrades their quality of life.
Right, and so here are the two things we've already discovered is that excessive sleepiness can be life-threatening if you're operating heavy machinery or driving a vehicle of some sort, but it can also rob you of quality of life, and it's so, I won't say easy to fix, but it's so treatable.
It absolutely is treatable. Virtually all of the sleep disorders that produce sleepiness are diagnosable and treatable. And our goal is to identify the underlying reason for the sleepiness and then to initiate a program of treatment to address the problem.
Exactly. Now, when I was doing this, putting this all together, I was getting kind of confused because excessive sleepiness is more like a fever than, say, a virus in the medical term. So I want you to give us your illustration there of the difference, of the similarities between that.
Well, excessive sleepiness is actually a symptom, and it's much the same as fever is a symptom. If you had fever and you went to the doctor, and the doctor did a physical exam and said, well, your diagnosis is fever, that wouldn't be a very satisfying diagnosis, and that's because fever is a symptom. You would want to know what is the underlying cause of the fever, and in the same way, when one has excessive sleepiness, the question to address is, why do I have excessive sleepiness? And that then leads to a proper diagnosis and appropriate treatment.
Yes, and so what does cause daytime sleepiness, excessive?
Excessive daytime sleepiness is caused by a large number of possible underlying causes. Probably the single most common cause in our society is inadequate quantity of sleep or a very irregular sleep-wake pattern. And of course, if that is the problem, then the problem should be fixed by increasing the total sleep time at night and obtaining sleep on a more regular, consistent basis. Once we've ruled that out, then we move into other possible causes of daytime sleepiness. A particularly common one may involve medication side effects. And if that is a cause, then we may be able to deal with that through changes in dosage or timing of the medication. Once we get past problems like that, then we're looking more at the traditional sleep disorders that may cause daytime sleepiness. For example, obstructive sleep apnea, which is a breathing problem during sleep, which fragments and disrupts our nighttime sleep, is often associated with daytime sleepiness.
Right.
This is a disorder that is best diagnosed in a sleep center. It requires an overnight sleep study to evaluate breathing during sleep, and then we treat the upper airway obstruction in a variety of ways to restore the person's quality of sleep and alertness.
Yes, apnea is behind several of the other sleep disorders, and once you rule that out, you find other things like restless legs and well, maybe even narcolepsy, which we're going to talk about later.
Right.
So sometimes you need to just get that taken care of so that you can see the second problem that's causing.
That's exactly right. It's actually not uncommon for us to find multiple causes of excessive sleepiness in the same patient. And so we simply have to enumerate the various contributors to excessive sleepiness and manage each and every one of those in order to optimize alertness.
Yes, and it's not that big a deal, and it's very manageable.
It is.
Now let's talk a little bit about shift work. I've talked to people that absolutely love being up all night long. I think it's just gross, but that's their best time of day, and they work at night. Then there are people that work at night, but it's not their best time of day, and for some reason they have to, but they can't adjust to it. What kind of sleepiness issues are we talking about there?
Shift work is a necessary part of our society. We in Memphis actually have a large proportion of our workers who are shift workers and work at night. I think that's in large part related to our transportation hub. Of course, we have shipping, for example, FedEx. We have airport personnel. We have law enforcement personnel and hospital personnel who simply must work at night. And so it would be a very simple, oversimplified solution to say, well, you shouldn't work the night shift. There are some individuals who simply must work the night shift. And as you alluded to, some individuals can adapt to night shift work quite easily and others cannot. For those who are struggling to adapt, there are a number of measures that can be taken to improve their ability to remain awake at night and to obtain good quality sleep during the day.
I bet they didn't know that, and they're fighting it. That's really why you ought to contact your sleep specialist. Just go in, sit down, and have a conversation and, you know, say this is what's going on, because they have no idea what interventions are available and how simple some of them are.
Well, that's exactly right. And in my experience, there often is a layering effect. In other words, the individual may be a shift worker, and they may have attributed much of their sleepiness to their shift work, when in fact there could be multiple components. There could be obstructive sleep apnea, there could be other issues that need to be addressed, as well as the shift work aspect of their problem.
And then it won't be so hard on them.